Hi, welcome to the video series on StrokeHub fact sheets. This topic is on bladder and bowel problems. It is common to experience bladder and bowel problems after a stroke. This can be a sensitive issue to many people and affect their overall well-being. Talk to your stroke care team if you are having difficulty with bladder or bowel control after stroke. Continence problems can be managed discreetly with good advice and preparation. Why do bladder and bowel problems happen after a stroke? You may develop continence problem after a stroke for various reasons. It could be from a central cause due to a damage in parts of the brain from stroke. It could be because of reduced physical activities due to disabilities after stroke. You may be at risk of experiencing constipation. It could be because of physical changes. Weakness and loss of sensation may affect your ability to move around. You may not be able to go to the toilet on time or may have difficulty maintaining control. Cognitive changes and speech difficulty after stroke may affect your ability to communicate your toilet needs to your carer. You may eat or drink less with changes in your diet consistency due to swallowing problems after stroke. Constipation can happen as a result of dehydration and a lack of nutrition. Sometimes drugs could be the cause. Some medication may affect bladder or bowel control. There are some complications as well. You may be at a risk of urinary tract infections, which can cause urinary incontinence. What are the treatments available? Here are the initial care after stroke. Monitoring your intake and output chart. The nurses will monitor the amount you drink, eat, void, and the number of bowel movement for several days. We'll also monitor your post-void residual urine measurement. The doctor or nurse may check the amount of leftover urine in your bladder using a bladder scanner or urinary catheter. A large amount of leftover urine may indicate a urinary tract obstruction or bladder muscles problem. Next is screening. If a urinary tract infection is suspected, a sample of your urine may be sent for testing. The use of assistive device. If you require mild to moderate physical assistance, the nurses may offer you a bedpan or urinal at your bedside or transfer you to the toilet via a commode chair. The use of absorbent pads and catheters. If you require maximum physical assistance or are not well enough to regain control of your bladder and bowel, you may be offered to wear diapers. If you are not able to empty your bladder completely, a urinary catheter may be inserted to drain the urine out into a bag. This may be inserted and kept for a short period of time or to be done several times a day to keep you comfortable and reduce the risk of urinary tract infection. Bladder and bowel training can improve the symptoms and restore normal function pattern of continence. Bladder and bowel training programs are usually customized to each individual. For bladder issues, you can work on behavioral techniques. You can train your bladder by holding off your urine for an amount of time after having the urge to urinate. This is to strengthen the bladder's ability to hold more urine and lengthen the time between toilet visits. Next, you can also schedule toilet visits every 2 to 3 hours instead of visiting when needed. You can also do pelvic floor muscle exercises. Pelvic floor exercises help to strengthen the pelvic floor muscles. This can improve bladder control and reduce urine leakage. How do you do it? Firstly, tighten the muscles used for stopping urination and hold for 5 seconds. Then relax for another 5 seconds. Perform this exercise at least 3 sets of 10 repetitions each day. There are several medical devices and surgical procedures to treat bladder incontinence. Discuss with your stroke care team. You may be referred to a specialist if required. Some medications may be prescribed to help and reduce urine production, urgency, and frequency. For bowel issues, there are behavioral techniques as well. Bowel training may be done through scheduled regular visits to the toilet. For example, after a meal when the bowel are stimulated to move by a natural reflex. It may help to improve your ability to hold and delay bowel movement till you reach the toilet. There are several surgical procedures to treat bowel incontinence. Discuss with your stroke care team. You may be referred to a specialist if required. For drugs, laxative or stool softeners may be prescribed to treat constipation. You may wonder, how can my carer or family help? For some people who have suffered a severe stroke, a full recovery may be less likely. In such instances, your stroke care team will assess and recommend according to your needs. For example, using diapers, permanent or intermittent urinary catheter. Good hygiene and skincare is important to protect you from urinary infection and skin damage. Here are some tips to cope with continence problems. Get support. Speak to a doctor or nurse about your concerns. They can advise you the appropriate options and refer you to a continence specialist advisor if needed. Next, skincare. Maintain good hygiene and skincare is important to prevent any skin damage. Barrier creams can be obtained from the pharmacy to reduce the risk of developing skin rashes and damage. For lifestyle, schedule regular toilet visits to avoid urinary accidents. You can also wear clothes that are easy to unfasten for toileting needs. Do keep an active lifestyle to promote regular bowel movement. For diet, reducing the amount of water intake before bedtime will help avoid late-night urinary accidents. You can also drink more water during the daytime instead. You are encouraged to drink 6 to 8 glasses of water per day, unless medically contraindicated. This can help to avoid urinary tract infections and constipation. Do also reduce drinks that contain caffeine and alcohol, as it may irritate your bladder. Do consume a healthy, balanced diet. High fiber food can help to prevent constipation. You can find more topics like this on StrokeHub at www.healthhub.sg/StrokeHub. It's a resource guide for stroke survivors and their caregivers. This is also accessible via the Health Hub app. Thanks for listening!